We are hearing the word more and more, gut disorders. It's related to constipation, bloating, but it's also a very misunderstood word.
Do you know one mystery? Human body is made up of two types of cells. One is microbial cells and human cells. Human body is made up of 100 trillion cells, 60 trillion bacteria cells, and human cells are nearly 40 trillion. So scientists call human as 50% human, 50% bacteria. And most of these microbes, bacteria, resides in our gut. And they are not just meant for digesting the food, production of vitamin, production of brain hormones. They perform incredible jobs.
I feel in my clinical practice, I see about 15 to 20 patients a day. Almost 50 to 60% come to me with gut problems, with dysbiosis, GERD, acidity, reflux, bloatedness, indigestion, diarrhea, constipation, and other issues. What they don't realize is that this is leading to mental anxiety, cases of severe depression, clinical depression, and other disorders also. A lot of people run to a psychiatrist typically when you're feeling low and depressed, not realizing that the serotonin receptors are actually sitting in the gut. Similarly, I have another 30 or 40% of my patients that come to me with skin disorders because they've been to all dermatologists across Delhi and they cannot find relief or permanent relief. They are given steroid creams and they are given facials and expensive products to apply on their skin. But the real cause of that skin disorder, whether it is vitiligo or psoriasis or eczemas or allergies or hives or any appearance of lines or redness or rosacea, all of these are coming from the gut. They don't realize that yet. It is the new discovery in the last 2 or 3 years actually that we've started to talk about everything related to the gut. So every cell of your body is communicating with the other cell. And there's a constant network of communication going on in our bodies. Everything that we're eating is actually causing an impact on everything from our brain health to our soul health even.
So what you're saying is that the gut is actually responsible for mental health, our skin, pretty much the entire body, right?
Yes.
How you treat it, how you look after your gut is something which is very important.
Very, very crucial.
Welcome to Health Mantra. I'm Arjun Bhagat and today we are talking about gut disorders and we have two very special guests with us. We have Dr. Praveen Jacob from Claireveda Clinic and also the founder and CEO of Alpha Natural, which is based on the principles of Ayurveda and functional medicine. And we also have Dr. Sanjay Sachdeva, who is the CEO of Meta Balance and also its founder. Two specialists in healthcare who are redefining the way medicine is practiced. Welcome to Health Mantra, Doctor. Let me begin with you, Dr. Jacob. What is this thing called gut? We are hearing the word more and more, gut disorders, and of course, it's related to constipation, bloating, but it's also a very misunderstood word.
Yes. Gut generally refers to digestive tract, the stomach, intestine, and colon, large intestine, which consists of gut. We had a notion earlier that the gut is to digest the food and eliminate the waste. Today, that notion is changing because scientists started identifying a mini creature in the gut called as gut microbes. Do you know one mystery? Human body is made up of two types of cells. One is bacterial cell, microbial cells, and human cells. Now, for instance, human body is made up of 100 trillion cells, 60 trillion bacteria cells, and human cells are nearly 40 trillion. So scientists call human as 50% human, 50% bacteria. And most of these microbes, bacteria, resides in our gut. And they are not just meant for digesting the food, they perform incredible jobs. 50% of brain hormones are synthesized in the gut by the help of bacteria. And addition to that, 70% of immune cells are located in our gut. Digestion of the food, production of vitamin, production of brain hormones, they perform incredible jobs.
So what you're saying is that the gut is actually responsible for mental health, our skin, pretty much the entire body, right?
Yes.
How you treat it, how you look after your gut is something which is very important.
Very, very crucial. And in my clinical practice, I found that 80% of psoriasis are gut related.
So explain for our audience what psoriasis.
Psoriasis is a skin disorder.
Right.
It's famously called as gut-skin axis. Most of the skin disorders are a result of indigestion. The undigested foods ferment and produce toxins. These toxins can trigger the skin lesions.
Right. So let's take one step back.
Okay.
When does the entire system or the gut, when does it become destable, if that's the right word that I'm using?
Yeah.
When do those complications start? I mean, what is it that we are doing wrong as individuals? Because the number of gut disorders or the complaints for, gut problems, we gastroenteritis and so many others that you were talking about just a little while back. How do those precipitate?
Yeah, in fact, let's look into environment. The milk transformed into yogurt by the help of bacteria.
Right.
So we South Indian use dosa, idli. The fermentation is mediated by microbes.
Right.
The dead matters are decomposed by microbes. All the garbages what we create are eliminated by the help of microbes.
Right.
So which implies that microbes plays a crucial role. Similarly, the food we digested are in fact converted into nutrients by the help of microbes.
Right.
Rather than our digestive enzymes. So when you don't have right number of bacteria in your gut, food cannot get digested. That leads to constipation, gas, bloating. Undigested food ferment and it became a toxin, in fact.
Right.
So that's contributed to various type of incurable disease.
Right. So how do we balance that?
Yeah, definitely.
Because each individual is different. Sab log alag alag hai. Everybody eats a different way.
Okay.
We are now having more and more fast food.
Okay.
The food that we eat is very chemical reliant, fertilizers, artificial chemicals are there. That purity of food, and we've talked about this earlier, Sanjay, is no longer what it used to be, say, 40 years back or 50 years back. So how are we affected by that?
Yeah, one of the major factor which damaged our gut, antibiotics. We know that antibiotic helps to control various incurable diseases like tuberculosis, leprosy, but there is a dark side of antibiotic which can eliminate good microbes as well. So each time when we consume antibiotics, that eliminates small little bit of our good microbes. It's similar to a forest fire.
Right.
Yeah. Second factor, the packed food, industrial foods, which are contaminated by additives and chemicals that definitely disturb our gut microbes. Third is cesarean section. There are numerous studies suggest that cesarean babies are lacking good microbes. For instance, when scientists evaluated the gut microbes of cesarean babies with the tribal kids, they found that 10-fold higher number of good microbes in the tribal babies, like in a normal delivered babies. So I feel these are the three major factors damaging our gut today. And top of that, our lifestyle, like junk foods, fried foods. Even in India, most of the Indians are vegetarian, but the consumption of vegetable is inadequate. I call them as grainitarian rather than vegetarians.
Right. No,
So,
you're right about that.
Yeah, vegetable,
We have to have a wheat chapati or paratha, and then of course in the south we have so much of rice.
Rice.
Maybe all 2 meals or 3 meals a day.
Vegetables are missing in our diet. Maybe I feel in Indian diet, we get 2-3% of total calories from vegetables. 80% of our calories we derive from grains like wheat and rice.
So what you're saying is, and you can add to that, Sanjay, what you're saying is that we really need to have a very balanced diet and good food, right?
Yes.
So that's the prevention of it.
Yeah. Thank you, Arjun, for inviting us to this show. Yes, I am Dr. Sanjay Sachdeva, PhD in nutrition. I practice most of Dr. Praveen's protocols in Delhi, and I represent him in North India. So I feel in my clinical practice, I see about 15 to 20 patients a day. Almost 50 to 60% come to me with gut problems, with dysbiosis, GERD, acidity, reflux, bloatedness, indigestion, diarrhea, constipation, and other issues. What they don't realize is that this is leading to mental anxiety, cases of severe depression, clinical depression, ADHD, ADD, and other disorders also. A lot of people run to a psychiatrist typically when you're feeling low and depressed, not realizing that the serotonin receptors are actually sitting in the gut. Similarly, I have another 30 or 40% of my patients that come to me with skin disorders because they've been to all dermatologists across Delhi and they cannot find relief or permanent relief. They are given steroid creams and they are given facials and expensive products to apply on their skin. But the real cause of that skin disorder, whether it is vitiligo or psoriasis or eczemas or allergies or hives or any appearance of lines or redness or rosacea, all of these are coming from the gut. They don't realize that yet. It is a new discovery in the last 2 or 3 years actually that we've started to talk about everything related to the gut. So every cell of your body is communicating with the other cell. And there's a constant network of communication going on in our bodies. Everything that we're eating is actually causing an impact on everything from our brain health to our soul health even.
Right. So, Sanjay, you talked about skin infections, you talked about mental health, but you just kind of touched upon it. Elaborate on that. Now, how does the gut actually affect mental health?
So I started actually a chanced upon it recently when I was starting to work on my second book, which is on cognitive longevity, unaging the brain. That is the title of the book. When I was doing research on this and I was interviewing neuroscientists, I came across that you actually should be interviewing gut doctors because if you're talking about cognitive health, cognitive longevity, avoidance of Alzheimer, dementia, and other memory lapses, you're not supposed to look at just the anxiety disorders from the mental point of view. It's actually originating from the gut. So then I discovered this thing about this gut brain axis, the GBA, and the importance of the gut brain axis. So every receptor of serotonin or dopamine and other happiness hormones is actually originating from the gut. So we need to look at our plate. What is at the end of our fork is what matters the most. That's how I discovered this whole story about the gut brain axis.
Right. So then, how, if a patient comes to you, Dr. Jacob, how do you actually go about diagnosing what that problem is? I mean, are there tests involved? How do you come to a particular, as you said, this is new research, right? And you, of course, are one of the pioneers of this. You've also come out with a number of products in your company to probiotic products. So how do you go about that? How do you actually say that, okay, how do you do the diagnosis? What are the steps that a patient needs to go through?
Yeah, so I feel how often you get the appetite and how is your motion passing? What's the consistency of your stool? Few says that it is very hard. Few says that it is like watery. Maybe few people says me they have bloating and gas. And psoriasis, I will ask simple questions. How long you are taking medications? And I ask a questions to you. Have you taken a particular treatment in Ayurveda called as Virajana, purgation? I asked them about their stomach acid. So what I found in my clinical practice, majority of the patient who complained about their gastric issues, they indeed have lack of stomach acid. There's a two condition, hyperacidity and hypoacidity. We always complain about hyperacidity, but hypoacidity is the most underdiagnosed area in the medical field.
And what we are doing is when we have this hypoacidity, we are mostly suppressing it with things like Digene gel and so
Yeah,
on.
and that Pandy
And
is
Pandy and
become the
Pantocid, this will
mantra.
become like a health mantra.
Right, right.
So across the world, there are every patient I see has got a prescription for Pandy and Gelusil or Digene gel or some
So what do these
similar.
medicines do? I mean, what harm do they do if they're taken again and again?
I tell you, the most dangerous medicine could be proton pump inhibitors, the hyperacidity medication,
Right.
because the stomach acid is for one purpose. The human stomach acid is 1.5, the pH of human stomach. The most acidic stomach in the all animal, compared with all other animal, human have lowest pH, highly acidic. That's for one purpose. The stomach acid is to filter the harmful microbes, which is contaminated by the foods. And it has the another second purpose of stomach acid to digest the food.
Yeah.
So when you dilute the stomach acid, harmful bacteria can enter to your body.
Right.
That leads to gut disturbance. So that's what Ayurveda mentioned about a condition called as mandakni. Mandakni is the term used in Ayurveda,
Right.
lack of digestive fire.
Right.
I feel that the lack of digestive fire can lead to chronic disorders
Right.
because there is one dangerous condition. So I asked about their stomach acid. Second, I asked them about their peristaltic movement like constipation, gas, bloating. These are the questions help me to understand and diagnose the gut disturbance and gut dysbiosis.
So then what's the next step? So you've diagnosed it, you've got all the answers.
We have a poop questionnaire, which, I mean, however gross it may sound.
A poop question.
Poop questionnaire. However, I said, however gross it may sound,
Right,
but we give a chart with pictures of poop and how does your poop look like.
right,
Many people answer that we've not even looked at it. We don't look at it.
right.
But it's important to see the shape, size, color, consistency, viscosity of the poop. And that's what determines your health. Actually, it's the best diagnosis.
Right.
It's the cheapest diagnosis. Instead of getting endoscopy and colonoscopy, look at your own health. Look at the symptoms. Your body is always talking to you. It's constantly communicating with you and giving signals. If you're stupid enough not to catch it, then you will go for expensive testing.
Right.
What Dr. Jacob is trying to say is that it is not expensive to test because your body is always giving you signs of what is wrong and how you're treating it. It will respond or react according to what you're treating it with.
Right. So let me just recap this discussion. What we are really talking about when somebody has a gut problem, some disorder, some discomfort, we need to look at a holistic picture, right? Rather than rush towards, how would you say it, interventionist kind of a model, which is the predominant prevalent model
Yeah.
in modern day medicine, right? So you want to get certain tests done and then you'll get into some invasive techniques of very high medicine dosages. So that is something we need to keep aside so that we can understand from both of you how we take it to the next level. Then what happens? In terms of, you've diagnosed the problem, how do you then treat a person? So I'm talking about generically. I'm not talking about, say, from a skin perspective or a mental perspective, because I guess those would be specific, but from a holistic perspective.
So there are three major digestive disorders. One is stomach related,
Right.
and that the underlying cause could be hyperacidity, too much acid or lack of stomach acid, which I will figure out by apple cider vinegar test.
Right.
I will ask my patients to consume 1 teaspoon of apple cider vinegar in a cup of water, and majority of the patients says that vinegar provided comfort to them. So that indicates that they have lack of stomach acids.
Okay. So what you're saying is 1 spoon of
1 spoon of
cider,
apple cider vinegar,
the one that we get in the market.
a market, mix in a cup of water, 200 ml of water, consume just before the food,
Right.
and if they feel comfort, that suggests that they have lack of stomach acid, not the too much of stomach acid.
Okay. So that balances it.
Balance. If they have lack of stomach acid, I have dietary interventions, natural protocol to boost the stomach acid. Around 40% of the patient have hyperacidity. They have too much of acid. So I use probiotic, herbal remedies, and dietary modification to lower the stomach acid.
Okay. So what happens is, especially from a consumer point of view, we've been hearing a lot of curd companies talking about probiotic curd. So that's not what you're talking about.
No, I'm not talking
You're
about.
talking about a test or diagnosis whether you have too much acid or too less acid. So if you react negatively,
Then when you give probiotics, that's what I'm talking about. So then you made special formulations based on Ayurveda.
Yeah.
So we've heard a lot about probiotics. Can you explain to us what probiotics are?
Yeah, probiotics are good microbes found in fermented foods like yogurt is rich source of lactobacillus, a probiotic. The pickles, the kimchi, most of the fermented foods are enriched with the probiotics. So that's a natural probiotics. Like toddy, fermented rice. So we consume in South India fermented rice. So good source of probiotics. So the second one is the fortified probiotics for probiotic supplements. So I use natural probiotics and supplement probiotics to reduce the stomach inflammation and gut dysbiosis. So the prebiotics are similar to soil.
Right.
Probiotics are similar to seeds. You require soil to germinate the seeds, So, yeah. So this both combination. Prebiotics are fiber. It's like similar to soil, and probiotics are seeds. The both combinations definitely helps to fix the gut disturbance and gut dysbiosis. So prebiotics are found in banana flour, lady's finger, flax seeds. Most of the fiber-rich foods are enriched with the prebiotic fiber. So I give this combination of probiotic and prebiotic, which definitely reduce the stomach inflammation and helps to counter the gut disturbance.
So, doctor, tell us about some of the diseases which directly are a result of gut disorder.
The common one is gastritis. Every second person in India suffer from gastric irritation, gastritis, or GERD, the reflux of stomach acid to the mouth. The root cause of stomach disturbance, stomach inflammation, a bacteria called as H. pylori. And we have a notion that spicy food or stress induce hyperacidity or stomach inflammation. It's a misconception. The fundamental cause is a bacteria called as Helicobacter pylori, which is found majority of the Indians. Once we counter this H. pylori bacteria, there will be remarkable improvements.
So in layman's terms, that's a bad bacteria.
H. pylori, the bacteria found in the stomach,
Right.
which is a fundamental cause for gastritis,
Right.
not the spicy food.
So that's if it's excessively present in your stomach, that will lead to complications.
That leads to
Then you need to neutralize.
neutralize that trigger the acid production in the stomach.
Right.
So, we have a good protocol, natural protocol to remove this harmful bacteria from the stomach that give permanent remedy. So, antacids cannot address this root cause. As long as you consume antacids, secretion of acid can be controlled, but bacteria cannot be removed by antacids. But natural protocols like using probiotics, herbs, and dietary modification address the fundamental cause,
Right.
which is a bacteria, a notorious bacteria called as H. pylori.
So how do you detect H. pylori? How do you test for H. pylori?
Yeah, there are antibody testings, breath test called as urease testing, culture.
Right.
So 3 ways one can detect but I found 90% of chronic gastritis patient, migraine patient, GERD patients are related to H. pylori bacteria.
Right. Yeah. What about skin diseases? Now, what are some of the skin diseases which are a direct result of gut dysbiosis?
Of yes.
So I do send this tool for investigation for psoriasis patient. See, digestive disorders like acidity, gastritis, indigestion, bloating, constipation, we don't require any complicated testing.
Right.
Simple question can help to identify.
Right.
But when it comes to psoriasis or autoimmune disorders, vitiligo, autism, they're complicated disorder. I send their stool for mapping.
Right.
It's called as stool mapping, So they detect the abnormal microbe. It's an amazing test to identify the root cause of chronic disorder. It's like a mystery. There had been no answer. The doctors prescribe endoscopy and colonoscopy. We can go as many times as possible, but you cannot figure out what is the root cause. But stool mapping is the best way to figure out
And so there's a direct link between, say, stool mapping and the result you get to a skin infection that somebody has been dealing with for a very long time.
Stool mapping helps to identify harmful microbes. For few individuals, there will be abnormal fungus overgrowth.
Right.
It's called as small intestinal fungal overgrowth. Few patient will have harmful microbes, excess of harmful microbes. Few have excess of parasites. So this tool mapping will helps to figure out exact root cause, and we develop a customized protocol according to.
Right. And when you say protocol, you mean a combination of supplements that you give?
Yeah, the protocols, we can say triple therapy. Definitely, food is the most forgotten medicine.
Right.
We place emphasis to dietary modifications, like a grain-free diet I propagate.
Right.
So, like rice, wheat, and more, even millets are removed for a
So tell me, why do you recommend the removal of wheat-based food?
It's not only
that.
the grains,
All grain.
all grains,
wheat.
including rice, wheat, and millets, are removed for 1 month.
Okay.
It's called as eliminatory diet.
Right.
That is very crucial to repair the gut microbe,
Right.
because there are 3 macronutrients we consume: protein, fat, and carbohydrates.
Right.
Gut microbes cannot utilize and process fat and protein.
Okay.
They thrive they munch on carbohydrates, what we
Right.
ingest every day. So when you restrict the carbs, in fact, it is a type, we are starving and removing the harmful bacteria. So it's very crucial step to stop all type of grains for 1 month. And I put them on lots of vegetable, good fat, and good protein.
Right. So if somebody is a vegetarian and is not going to eat, say, a chicken or a fish, then what would some of the alternatives be for them?
Yes, it's type of steamed vegetable, salads, fruits, avocados, nuts.
And of course, dals and all are.
That's our stop because that's our
Dals are also
dals and pulses are
okay.
Lectins.
yeah.
A big thing that is now being talked about in dal is lectins.
Right. So tell me a little bit about lectins.
So lectin is like the body will respond or react to an attack.
Right.
You are somebody is going to attack you, you will respond back.
Right.
So the dal also produces lectins, which is a nature's own way of protecting the dal. Dal itself releases lectins,
All right.
which is a harmful substance, and that's why Stephen Gundry talks about the lectin-free diet. So that's why dals are eliminated from this thing. What he's talking about is elimination diet. So dals and all grains are taken out. So anything that's inflammatory or is causing any kind of gut inflammation will be removed from the diet for that time that you are repairing, because the gut permeability is so sensitive, and it's so often happening to us with sugar and with wheat and with milk and with other hormonal induced foods, that the gut gets punctured and we get a syndrome called leaky gut syndrome. So when the gut is a very thin lining, the mucosal lining is very thin, and that gets punctured. So it's like you are trying to water your garden, and the hose has got multiple holes in it. So the water will never get to the pot, right? It's like that. If your gut has got permeability in that, it has got holes in it, your food that you're eating will not get digested and will not pass to this 30 feet long gut length, but it will leak out in between. So undigested food will leak out into your bloodstream. And that's what causes all the dysbiosis.
So, doctor, is there a relationship between skin cancer and gut disorders?
Yes, I don't feel skin cancer is related to gut dysbiosis because skin cancer could be by human papillomavirus and ultraviolet rays from the sunlight. This is a major factor for skin cancer.
Right.
Yeah. But colon cancer and stomach cancer are related to gut dysbiosis.
Right.
Yeah.
And you found, researchers found...
there are numerous studies suggesting that colon cancer, a harmful bacteria in colon called as secondary bile converting microbes, they had been implicated of promotion of colon cancer. And stomach cancer, definitely 95% of stomach cancer, I feel, which is fourth leading cause of carcinoma in India, are mediated by H. pylori bacteria, Helicobacter pylori bacteria, 95% of stomach cancer. Even liver cancer could be related to some of the gut microbial dysbiosis. Not all cancer.
So, now let's move towards, mental diseases that people have. Is there a correlation between, again, gut disorders, problems with the gut, and, mental disorders or anxiety that people have? One keeps hearing about stress. How is all that related?
So psychiatric disorders induced from stress. So let's say that it all begins in the stress. Every thought has a 1.4 volt of current generated from thought. Each thought that you think, positive or negative, will generate a vibration in the body and in the mind, and that will help to release hormones from the mind, from the pineal gland, from pituitary gland, from your liver. There are hormones being released everywhere in the body, and those are triggered by thoughts. So it all begins from the stress. Once there is stress, and then it is coupled or accentuated by the wrong foods that we are having, the wrong lifestyle, the wrong sleep, no exercise, no muscle mass, chemicalized foods, which are what we're eating today is not actually food, it is food-like substances. So when we are inducing that as well as the stress, it triggers whole spiral of negative emotions. And every emotion then is therefore converts into a physical disorder. So every thought that is generated in the mind will have a physiological response, and vice versa. Every physiological thing that you're doing wrong will generate a mental anxiety or disorder.
No, I understand what you're saying. That, of course, everything is interrelated to the other. But how do you actually go about diagnosing, or how do you do a diagnostic test for a mental disorder, and then say that it's related to your gut, or the way or the way you eat, and the way you kind of choose your foods? So I think that's important for people to understand.
Normally we do a thing called neurotransmitter tests. if you want to detect if there's a mental psychiatric disorder, if we see if there's a release of dopamine or serotonin is reduced, most of these neuropeptides are released from the gut. So if there is a, usually you start feeling miserable. People come to me with a lot of mental stress, anxiety, depression, feeling low. So it's either your the food that you're eating or your hormones. There are only two reasons why it can happen, unless it's a situation triggered response to stress, or there's a negative thought or emotion, there's a stress that you're going through, and it's triggered by an external circumstance, like an illness in the family, you lose a loved one or something like that. Then that's another situation that has triggered that stress response. But if there's no such trigger, then it is related to the gut, or it is related to hormones. Again, hormones are related to the food that you're eating. So what he's saying is kind of connected in the way that, so you will start to feel the stress when people come to me not with a test report in hand. There's no test to measure stress except cortisol.
So, doctor, we've been hearing a lot about irritable bowel syndrome. What is that, and how does that manifest? I mean, both of you could answer that question.
Irritable bowel syndrome, I love to call it as irritated bacterial syndrome.
Right.
Yeah, the underlying cause has been identified now, called as small intestinal bacterial overgrowth. Typical symptoms of IBS like loose motions for few people. For people, it could be constipation dominant, gas and bloating, depression, anxiety. So typical symptoms of irritable bowel syndrome. So one of the most successful model we could develop to eradicate irritable bowel syndrome. The protocol consists of a good diet, definitely a glucose-free, fructose-free. Even I stop the fruits for irritable bowel syndrome patients for a span of 2 weeks. Next, I use probiotic and herbal remedies because it's written in medical books that irritable bowel syndrome is incurable.
Really?
Yes, it's written in medical books, incurable. It's related to your stress. Neither stress or genetics leads to irritable bowel syndrome because the IBS patient, they goes multiple times for endoscopy. Every time the test turns out to be negative for IBS patient, and doctors finally dictate you don't have any issues, it's your mental problem.
Right.
They are dictated as a mental patient. But, I feel it is strongly related to irritated bacteria in your gut.
And you've been able to cure your
Yeah, definitely. This is the one condition, 100%. I can assure you, by changing the gut bacterial diversity. So I use a protocol to remove harmful bacteria and called as small intestinal bacterial overgrowth. If someone suffers from irritable bowel syndrome, just they can study this term called as small intestinal bacterial overgrowth. It is neither stress nor your psychiatric issues leads to irritable bowel syndrome. This notorious bacteria in your intestine, small intestinal bacterial overgrowth, where I have 100% successful protocol. And 10% of Indian population suffer from irritable bowel syndrome. Both the types. It could be few people diarrhea dominant. For few individual, it could be constipation dominant.
Right. So constipation is another issue which we deal with a lot. I would like the doctor to define what is constipation. Many people feel that in reality, let me rephrase my question. People who are so-called toilet trained by their parents because they have to go to the toilet in the morning and then they have to go to school. Kids are trained like that this is enough. But in reality, according to my understanding in my study, you need to go 2 or 3 times. And why? Because when you have lunch, for example, you digest your food in about 4 hours. Then, and you go to sleep so you had lunch at 1 o'clock and you are holding on to that digested, defecated matter in your large intestine for the whole night.
Right.
So we are trained to just go to the toilet once and that's fine. So everybody who I ask that question, that are you digesting your food properly? Yeah. I go to the toilet every morning and I'm able to defecate and I'm able to release everything and I'm happy. And I said that's not enough. So you need to do, you need to.
But these are societal norms in many
Yeah, but
ways, right?
they made people sick.
Generations.
But they made people sick. That's the question is,
Right.
what are we dealing with today?
Right.
Constipation is the main cause of piles and hemorrhoids and which leads to colorectal cancer.
Right.
So, but we are not able to define constipation. People don't have the understanding of it. And what he's talking about is to able to not just eat nutrient food, to assimilate, to digest and to eliminate. 25% importance to each one of them. That's how important this is. All the four have to be functioning optimally. That's what is good digestion.
Even many patients tell to me, we are not eating adequate amount of vegetable in the diet. Lack of fiber causes the constipation. I feel it's a misconception because lack of good bacteria contribute to constipation.
Right.
Lack of bowel movement, lack of good microbes. So when we don't have adequate amount of good microbes, food is not processed properly. That is a fundamental cause. When I repair the gut bacteria, when I improve the gut dysbiosis, many of the patients get permanent recovery. They need no longer the required laxative in every day.
So I have a people, almost everybody I know, or I would say 50% to 70% people are taking some sort of isabgol or some laxative.
Right.
Nice.
Isabgol is
And
Will there
others,
for a
many
bit of
others.
time.
Of course, isabgol is a natural fiber, but there's a lot of other people taking, allopathic, modern medical syrups and medicines to get.
and the night before. A lot of
the night
people have it
before.
the night before.
So it's basically you're taking an aid to digest your food or to eliminate food in the morning. People have a laxative at night. So is it harmful in long term or is it okay?
Yeah, so constipation is known as mother of all disease because food stays in your stomach for longer time. Maybe, that can fermentation of the food,
Petrification.
petrification or fermentation of the foods, So what I found that the patients, the laxatives, they became depends for a long time. But by using some probiotics and natural prebiotics, I found they get complete recovery. And don't feel it's a good strategy to use laxative for longer period of time.
And but people do that, right? They get addicted to it, and then
Yes, they get.
they say we'll take laxatives, and maybe an isabgol is fine because you said it's natural. But
Again, dependence on any external thing. Our body is
for a very
trained
period of time,
eat good food, assimilate good food, digest good food, eliminate automatically, naturally. You should not need any
like external aid.
external aid
doing
to
that.
do this, either to sleep or to eliminate your food. You should not need, your body should function naturally. Once in a while, it's okay, but not to make a habit of it.
So, Dr. Jacob, you run a company in which you are making products, probiotic products to help the common person, right? The company is called Alpha Natural. What exactly do you make, and how costly is it? Can the common man or the common woman, can they actually afford this?
So basically, I'm dealing with the plant extracts. It's called as nutraceuticals. Nutraceuticals are food supplements. They're found to fortify health. Addition to that, my nutraceutical categories are targeting gut dysbiosis, and I use probiotics, herbal extracts, and vitamin supplements.
So, give us an example.
For example, stomach acidity. As I pointed out, it's related to a harmful bacteria called as H. pylori.
Right.
So I composed a formulation based on Glycyrrhiza glabra. It's called as lycorice in India. It's a common herb available in India. And I use cumin extracts, turmeric extracts for my formulation. And all these extracts are found to be counter H. pylori bacteria.
Right.
And very cheap. In fact, my gastric combination called as Helacid, which can eliminate H. pylori, cost only 200 rupees. Majority of my medicines are range between 200 to 500 rupees. It's mostly affordable for my patient because I run a hospital in Karnataka, 200 bedded hospital, and we have 100% occupancy at any given point of time. Even my OP patients, is maximum they had to bear 1,000 to 2,000 rupees per visiting for 1 month course.
So you're doing yeoman service.
Yeah, it's very, and even psoriasis, I get complete recovery below 5,000 rupees. Because the combinations are formulated by myself. All aspect of manufacturing is taken care by myself, So the cost of manufacturing is very low, but the quality of my medicine, major problem with the food supplements and herbal products, contamination with heavy metals.
Right.
Yeah. For instance, European standard is 3 for heavy metals. Mine is 1/10 of European standard. Extremely low in heavy metals. So I could ensure the quality and good efficacy. Most of the products are developed by myself, by my own observation and my own research, because we have a huge patient base in Karnataka, 200 inpatient and 200 outpatient every day.
एवरी डे। इसका मतलब ये है कि अगर 400 लोग रोज के देख रहे हैं तो 1 लाख से 1.25 लाख के करीब पर ईयर आप सोचिए पेशेंट आते हैं। तो ऑब्वियसली ये अफोर्डेबल होना चाहिए, ये कॉमन मैन के लिए
तो
अफोर्डेबल।
आप ये बताइए हमें, अगर कोई फंक्शनल मेडिसिन जो नॉर्मल जो हम डॉक्टर्स के पास जाते हैं, 1 महीने का जो कोर्स होएगा इनका 1,000 से 2,000 रुपए का है। जो नॉर्मल जो डॉक्टर है who's using functional medicine, we also have a lot of international nutritional experts advocating a lot of things, and we are consuming that, on social media.
Yeah.
How much would that cost?
So right from 25 to 30,000 rupees of diagnostics in modern functional medicine diagnostic tests से लेकर के up to 75,000,
25 से
25,000 से लेकर के 1 लाख रुपए पर मंथ तक का खर्चा होता है फंक्शनल मेडिसिन में, अगर प्रॉपर तरीके से, क्योंकि सप्लीमेंट्स आर एक्सपेंसिव, many IVs are from abroad, they are not made in India, many supplements are not available in India, bioidentical hormones are not really available in India, so बहुत सारी चीज़ें बहुत एक्सपेंसिव भी पड़ सकती हैं, इसीलिए कॉमन मैन की रीच से बाहर हैं और ये इंश्योरेंस कवर्ड नहीं है। डॉक्टर प्रवीण के आने से एक नया जरिया, एक नया पर्सपेक्टिव, एक नया व्यू पॉइंट इस चीज़ के ऊपर आता है कि फंक्शनल मेडिसिन को और आयुर्वेदा को कंबाइन करके हम कॉमन मैन तक पहुंच सकते हैं। ऑर्डिनरी डिजीजेस विच यू आर फाइटिंग विद एवरी डे, एंड आई वुड से if you cover all the mental disorders or the psychiatric disorders and all the skin disorders and all the gut disorders, it would combine to form at least 70% of India's healthcare budget. इस सब बीमारियों को आप 2,000 से 5,000 रुपये पर मंथ में ठीक कर सकते हैं। That is the whole idea, is to bring it down to the masses now. The time has come that this whole
and it's part of our heritage, right? Ayurveda is part of our heritage.
Yeah.
So why is it being ignored so much? I mean, you're talking about it, Dr. Jacob. You're talking about it, Dr. Sanjay Sachdeva. But why is it not in popular discourse? हम लोग इसके बारे में क्यों नहीं बात कर रहे? I mean, the solutions that are available at a cheaper cost, no one seems to be really talking about.
I feel strongly one of the major issue I found in South Indian Ayurveda doctors, they don't have courage to practice their own system. 90% of Ayurveda doctors tends to prescribe allopathy medication. So that indicates that we are lacking the confidence. That is a major obstacle I found with Ayurvedic doctors, So then second is lack of awareness. So I often visit Mauritius and Malaysia. I deliver talks to doctors. They accept our system better than Indians. So we have a notion that everything comes from Western side is better, superior than our own system.
Right.
So that is a one complex hindering our growth, in fact, So one is the education about the scientific aspect of Ayurveda medicine. It's the best science in the world. 5,000 years ago, Ayurveda is the first science to proclaim that all disease begin in the
And it's in tune with the Indian body. Right?
Indian body. Yes,
That's something that a lot of people are also kind of talking about, that does Western medicine alone, is it made for the Indian body? So that's an important part.
That's what even Ayurveda told 5,000 years ago, all disease begin in the gut. But modern science started recognizing gut from the past 1 decade.
Right.
See, 5,000 years ago, they could identify, So the best science in the world is Ayurveda, but it is not explored. We have to do research. We have to scientifically propagate it. And quality is another important aspect. Most of the Indian medicines are rejected in foreign countries because of heavy metal contamination and heavy amount of steroid contents, So this standardization is a very crucial. Education, standardization, educating the Ayush doctors about benefits of Ayurveda. These are the steps help us to progress.
So then how does your company, which is Meta Balance Healthcare, has tied up with Dr. Jacob's company, Alpha Natural. But how does one actually access, both of you and as well as the products that your company is making?
So I would just like to add that I'm not against Western medicine or modern medicine.
Right.
I think the time has come to integrate medicine.
Right.
Every form of medicine that works, I believe in that.
Right.
Whether it's homeopathy, Ayurveda, modern medicine, wherever it's required, if it's required to save your life, if you have an accident or there's an emergency, you have to go to an ER and save your life. You will need some form of antibiotic at some point of time.
Right.
But if you have 6 rounds of antibiotics in a year, they stay in your gut for 3 months. one
And they
round of
will
antibiotics.
destroy the good microbes.
So one round of 7 day or 5 day course of antibiotics will stay in your gut for 3 months. So if you have 4 or 5 times a year, you can imagine you are living with that constant attack of on your gut microbiome. So what I'm saying is that yes, it is important to understand that Ayurveda is a fantastic science. It's very old, but what is required and why it is not popular, to answer your question, is that because there's enough research has not been done on the herbal formulations, because no pharmaceutical industry is keen on doing studies on Indian herbs and Indian plants. The studies are not done on that. Therefore, we need to validate the protocols that we are talking about, scientifically prove that they work, create quality environment, create awareness, like he's saying, and make people believe in the science, that the Indian science does exist, which works. It makes people feel better. Whoever I give this formulations to, they always come back happy. The bottom line is that. So I'm only caring about the patient's wellness and happiness.
Right.
All I care about is the patient has to get well. Whether he uses a homeopathic formulation or this formulation, it does not matter. Patient has to feel well.
Right.
That's the bottom line. Disease-free life is what we are aiming for. How to access? I'm available in Delhi. Dr. Praveen is. We have call
And
centers.
we'll give the details on this
We have,
video podcast.
Call the number, we are always available. There's a bunch of about 15 to 20 doctors that are available on call, and at any time when you call that the number given on the podcast, there'll be somebody to receive your call. It's not just that they depend on me or him.
Right. And
there's
of course, we'll put the website as well as the phone number there. And we can, anybody who wants your help will definitely try and reach out to you. So, Dr. Jacob, what are some of the misconceptions when it comes to one's gut?
So everyone believes that gut health means digestive issues. No, gut goes beyond digestion. Gut is an important site for brain hormone. Gut is the crucial center for vitamin absorption, vitamin production. Gut produces brain hormones. Gut control our immunity. It is not merely digestion. Second misconception, people think that taking a antacids or gels will fix your all digestive problem. No, the root cause is gut disturbance, mainly by H. pylori bacteria. And antacids reduce the stomach acid, but it cannot address the root cause, fundamental cause. You get a temporary relief for 1 or 2 days. Third one, many of us tell that, okay, doctor, if I take just a probiotics, there are lots of probiotics are available. Can I fix my gut? No, it is a healthy lifestyle is important. It's a holistic approach, a integrated approaches. So I always remove harmful food from diet, like junk foods. You need to stay away from industrial food, packed food, be on lots of vegetable fruits for 1 month to fix the gut. Then stopping the carbohydrates. Sugar is the important, sugary beverages. Second, adding lots of fiber-rich foods. There are 2 types of fiber, soluble fiber and insoluble fiber. Soluble fibers are the cornerstone of backbone of fixing the gut dysbiosis, gut disturbance. So, soluble fiber is found in flax seeds, sabja seeds, sunflower seeds, banana flower, banana rind, lady's finger, dragon fruits. These all are rich sources of soluble fiber. So it is just by integrated approach can fix the gut dysbiosis. Merely popping on a probiotic cannot help you to fix the root cause.
What is your mantra for a good, healthy gut and a body? So that, our lifestyle improves, our health improves. What advice would you give our viewers?
Yeah, so I use lifestyle modification is the main steps. So majority of the disease in India today mediated by excess calorie, not by our genetics or inheritance. Excess calorie is the major culprit. It is highly dangerous. Diabetic to cardiovascular disorders are strongly related to too much food, not the lack of food. So intermittent fasting, definitely amazing way to control blood glucose, diabetes, obesity. So I propagate intermittent fasting. Second, there is a misconception about dietary choices. Majority of the people, ordinary people, believe that fat is dangerous. Fat cause obesity, fat cause heart attack. But in my practice, I found that when I substitute carbohydrate for fat, most of the parameters improves. So adding lots of fat. Second, third step is adding lots of vegetables and fruits to the diet. So Indian diet, it's called as vegetarian diet, but unfortunately, vegetables are very small, maybe 1% of the total calories. So adding lots of vegetable to the diet. So then stopping the junk foods, that's also important, plays important roles. And reducing the dependency of antibiotics. So fiber-rich foods like fruits and vegetable. So this collectively, all this, this dietary modification helps to fix the most of the ailments.
Dr. Sachdeva, you're a nutritionist. You advise people on good health. What is your mantra for good health and a good gut?
So I think in addition to what Dr. Jacob added, I think epigenetics has a big role to play. And epigenetics consists of everything from the people that you meet, the friends that you keep, the books that you read, the TV that you watch, the meditation that you do, the thoughts that you generate in your mind, the sleep quality, the exercise, your muscle mass, your fat mass. All of these things are very important part of the growth strategy for making a healthy body. It's not just elimination of disease or not having any pills. It's also a feeling of holism, a feeling of holistic being, that you feel happy and you're constantly vibrant, you are full of energy, you can work 18 hours a day, 365 days a year without falling sick. That is my definition of a good health mantra. If you are in that state, virtually bulletproof your body for no disease, that's when you are achieved success in health.
Right. And that was a very enlightening episode on gut health and your health and how to keep yourself healthy and happy. Thank you, Dr. Jacob. Thank you, Dr. Sachdeva, for coming on Health Mantra and talking to us about some very, very crucial aspects of our life, which we kind of tend to ignore and don't really pay much attention to. Thank you once again for joining me on Health Mantra. All right. And we'll see you again with another episode of Health Mantra very soon. Goodbye.
ऐसी ही दिलचस्प और महत्वपूर्ण हेल्थ इश्यूज के बारे में जानकारी प्राप्त करने के लिए देखते रहिए हेल्थ मंत्रा।